Hello, everyone. I used to live in Boston for 20 years, and I did anything I could not to drive. And it was the beginning of the big dig. How many of you took Uber in the last month? Raise your hand. Oh, wow. They would love to see this. So would you have taken Uber if you indicated you needed a ride, and they said, we'll be here whenever, and with whatever vehicle? It might even be unsafe or unclean. Your driver has 2 stars out of 5, and don't always expect to get to your destination. We might let you off halfway and do a handoff. We might take you 10 miles longer than you wanted to go. This Uber nightmare would drive you away. But when you go for a ride on your healthcare system, you're accustomed to the nightmare. You expect it to be unreliable, possibly unsafe, and definitely inefficient. So I've been banging my head on this problem for 20 years, so I'm here today to ask you for some help. Let's see what we would do if we had a different focus. I used to love to make shoebox villages as a child. I would make the people out of girdle garters and little wooden clothespins. I'm looking around the audience. Most of you have never seen a girdle garter. They have little faces. They're terrific. And ask your grandmother. And in these villages, this was my idea of utopia, right? It was an imaginary place where there was moral and political and social perfection. And I had, there was no war in my villages, there was no hunger, and every school had a soda fountain. I got a little older, and I didn't want to make imaginary villages. I wanted to make really make a better world. So people would ask me as a teen, what do you want to be when you grow up? And I would say, I'd like to be a socialist labor organizer like Emma Goldman. And that was not what they expected, particularly at a country club. So time went on, and I developed a passion for social movements. Because what is a social movement than the realization of a utopian vision? And I will tell you this, I was born at the right time. So I entered college in the radical 60s. My brother said, I never met a movement I didn't like. That was before the Tea Party. Going into current politics. But, you know, civil rights, I mean, how could I have been born at a better time? Went down the hill from Brown University. We worked on a desegregation plan for the Rhode Island schools. War on poverty, I worked at Worcester just when it was getting off the ground. I worked here in Massachusetts, deinstitutionalizing the mentally retarded. And then, of course, there was the feminist movement, the Women's Health Collective, if you remember. I had childbirth my way. It's a small gesture. But you know, at least it was painful, but at least it was my way. So look at the activist 60s. I was on a roll, right? Mothers Against Drunk Driving. We had the Buckle Up campaign. We had designated driver. We even got the drinking age raised to 21. Race for the Cure here in Boston, one of the first races. We took breast cancer out of the closet. It was very thrilling. And AIDS, well, you know that was successful. So all these movements gave me a taste for success, but I was a bit player. Then I came across the problem for which there was no movement. There wasn't a movement to join. I'd have to join my own. So I had heard about Betsy Lehman. I think most people did, the Boston Globe award-winning health reporter who went to Dana-Farber for care for her breast cancer, got a massive overdose of chemotherapy, mother of 2 young children, and she died. I thought that was a one-off event. I thought, you know, this is really sad. Terrible things happen occasionally. And then I opened an academic journal, saw an article by Dr. Lucian Leap at the Harvard School of Public Health. I couldn't believe it. 3 jumbo jets, the equivalent of 3 jumbo jets crashing every 2 days in terms of death from preventable medical error. That's 100,000 people. So I've been part of social movements. I couldn't find what I knew what I had to do. I had to form an action group. So although I run a healthcare foundation, we formed a multi-stakeholder region quality improvement collaborative called the Pittsburgh Regional Health Initiative. But you know about social movements. We had to have a vision. So I used waste because we were early on a product of the business community. And I said, and there was a lot of data to back it up, 40 cents of every dollar you spend on healthcare buys complications, inefficiencies, overtreatment, and medical errors. But if you stick with us, we'll deliver 100% value. This waste has an opportunity cost. It's not just waste. It's what we don't spend on care management, patient education, mental health services, cheaper drugs, hospice, home care. There's a cost to this waste. And the cost is, among all affluent nations, I think many of you know this, we are at the bottom in terms of population health. On every single indicator, we have shorter lives, poorer health, and we lag behind any other affluent country, even though we spend twice as much per capita on health. So one thing, if you hate inefficiency and waste and unsafe conditions, industry has worked on this for years. They use industrial engineering techniques. So when we realized these weren't part of health professions schools, we brought them to healthcare. We were on a roll. We formed our own university. We did training across the country, even across other countries. We trained 10,000 people. We're feeling good. And many of those people use those same techniques for dramatic improvement. We had evidence that they work. Somebody wrote a book about us called The Pittsburgh Way. It won the Shingo Prize. It was translated into lots of languages. I got to travel the globe. We're feeling really good. There we are on the cover of Modern Healthcare. We said, do you guys know we have a terribly perverse payment system? We actually reward waste, inefficiency, overtreatment, complications, and medical errors. We got a whole section of the Affordable Care Act. Nobody seems to know about it, but a whole section of it was devoted to these issues, trying to improve the quality of care and contain cost. It didn't matter. We were moving the needle not at all. According to the National Patient Safety Foundation, we have 400,000 deaths from preventable medical error. Try and let that sink into your head. In my own state of Pennsylvania, 58 wrong site surgeries last year. Give me a break. You can't mark the surgical site. We can't plant a turnip in cement. The soil doesn't grow quality. All of these wholesale silver bullet solutions, educating people outside of the established education system, presenting data to a lot of people, even passing legislation, wasn't fixing the problem. We knew we needed something else. Wholesale didn't work. We wanted to go retail. And that's when I got a call from Dr. Joanne Conroy, who's CEO of Leahy Hospital here, and she said, I know you're frustrated. Come join another group of women who are also frustrated. Please come to Washington. Let's get together. Let's talk. So that's when we got together and called ourselves Women of Impact. Amazing group of women. We represent every spectrum of healthcare. Journalists, activists, people who run health systems, people who work in insurance, people who are lawyers, people who are doctors. We cover the waterfront. But one thing we know is women were triple victims. As professionals, we don't face pay equity. We face pay inequity. We're not represented fairly on the boards of health systems. We're certainly not CEOs of the largest health systems, and none of us run a Fortune 500 health company. So as victims, we said we've got to activate a lot of people. We've got to work together to get the healthcare system we want. So we're forming the Women's Health Activist Movement, WHAM. And even if you're men, please join us. I don't think it's utopian dreaming. I think we could get the healthcare system we want. I think we could have that customer value ride that we don't have now. So you're wondering, what can I do? Here's what you can do. Demand transparency. You should know the price of your care. You should know the quality rating of every doctor, surgeon, anesthesiologist, and radiologist that touches you. You should also reward the high performers. You're using Uber and not a taxi because it gives you something of value. Do the same with healthcare. I really want you to give instant feedback. You do that on Uber, right? They don't only, you rate the driver rates you. It happens right away. Say, doctor, I don't feel good in your practice. I'm not having a good experience. Or nurse, I feel vulnerable. I feel unsafe on your unit. Share your story. One of our Women of Impact, Diane Stallenwerk, has started the Patients View Institute. You can record your story. Let health professionals know what experience you had. Resist overtreatment. Ask your doctor, do I really have to have this drug, this diagnostic, this intervention? And if you have any doubts, go to the internet. Be a citizen scientist. Yes. Be a citizen scientist. The NIH is going to make this easy for you. Believe it or not, they're coming out with a new app. One of our members, Sharon Terry, was a college chaplain. She had 2 children born with a rare genetic disease. She went to the bench, she discovered the gene, she patented the gene, she set up a DNA bank. She also formed an action group called the Genetic Alliance. 300 genetic diseases are represented. They passed legislation banning discrimination on the basis of genetic disease. And lastly, fight waste. We all have to fight waste. Think of all those good things we could buy and the population health that would result. One of our members, Dr. Vivian Lee, you might have heard about her last week. She was on NPR. She said, why am I spending $300 and more for an EpiPen? I can buy an EpiKit for $10. My nurses can fill a syringe. She saved her system $35,000, but what if that spread around the country? All of us acting together, we'd create ripples, and the ripples would become waves, and the waves would become a tsunami. And lastly, for all of us, men and women, fight inequity. Why should women get 20% less in the same position for the same amount of time as men do, and be unrepresented in all of the decision-making bodies? So we gave you some ideas, give us some ideas. It's not a utopian dream. We can have an Uber-inspired healthcare system, but it has to be retail. I need all of you and everyone else listening to this TED Talk to help us. Thank you.